Getting dental implants abroad doesn't have to be stressful. We spoke with a top Bangkok dentist about the 4-step system they use to prepare nervous patients.
So patients get a very clear idea as to what is to be done.
The final step is crucial for your body. Don't miss it.
We have online consultations with our patients through video call. So we've heard it from so many of our patients through their voices. One of the biggest factors that they chose to come to us was because we stepped on a video call with them to speak about their concerns, what they're looking to get, their timeline, how long are they here for, what their budget is, what they want to get done, where we go through, the different treatment options, the different alternatives that are there, the pricing, the brands, the implant systems, and work out on their timeline since that day. So patients get a very clear idea as to what is to be done, what options they have, what limitations there are, what benefits are of each of the options that they can go for, whether or not we can do the treatment and how much we can complete, whether they have to come in for another trip, whether they have to be here for 3 trips, how long they have to be here for each trip. We discuss all of that since the first day through the online consultation by Google Meet. So this is one of our strongest points because we step on that. Our video calls are done directly with Dr. Vish and or myself, Dr. Vic. So we step in and do the video call with our patients since day one. So once we have all of this, the clinic, then our team sends a detailed, thorough treatment plan of what we discussed. We send it over to our patients so that they have a clear idea as to what they're dealing with. In some cases, patients, if this is possible, is also fantastic. If patients can provide us with any records before we hop on that call. For example, patients have any x-rays, photos, any scans, any notes that they've had from their previous dentist, that makes the treatment planning even more definitive and even more concise. So of course, we do note that the treatment planning is subject to change. It all depends on what we come in and check when we meet the patient. It also depends on other examinations that we need to do, but at least the patient has a nice rough idea of what treatment is to be done before they even fly in here. Before arriving to the clinic, we usually do like a deposit to get a confirmation from the patient. So we book in our doctors, we book in our scheduling, and everything can be done via online. A link is sent to the patient, the payment is done. The second step is, we have a team dedicated to checking if patients need help with airport pickup, which usually is inclusive, any hotels that they want us to help book. So we have 20-30 partner hotels that we work with, and the rates that you get through us are most of the times even more affordable than what you get online. Once you're here, we have everything is done digitally, meaning as soon as you arrive, all your records you can register by yourself. We have 3D x-rays, we have scans, we have a studio. We do a thorough consultation again with one of our doctors to make sure that whatever we spoke online and whatever we are going to be planning out now also matches. So we then finalize the treatment plan again, so you know exactly what needs to be done. Now that we have all the information, we plan out the treatment and then we get started right away. At our clinic, we do oxygen therapy. There are some medications that you can take. In Thailand, it's not very big to use nitrous oxide, so not available in all the clinics. And even though it is not fully numbing. And again, as I mentioned, it doesn't take away, what you have to go through when you lie down on the dental chair, especially for the all-on-next treatment. But for other treatments as simple as for example, a dental implant, a local anesthesia, even if you have anxiety, local anesthesia is completely fine. Our doctors are very, very qualified. A single implant can take as fast as 15 minutes to be done, 15 to be done. So before you even know it, the chair is already coming up and the doctor is already saying, implant's done. So dental implants in terms of the treatment, not very complicated. But if you're getting multiple implants, you have to do extractions as well. It becomes a bit more complicated. 4, 5, 6 implants. Some patients also can then choose to do it under general anesthesia. We also have that option available, depending on your level of fear and anxiety that you have with the dentist. So once they arrive, we do the whole test. We always recommend to do the medical clearance a day or two before, not on the day of. For medical clearance patients, we do recommend to avoid eating or drinking anything for about 6 hours. So the different packages that we coordinate with the hospital, we went for the biggest one. So we check everything in that package. As I mentioned, when we do this, we also know what blood type. This is standard that we do anyways, but we do a full body check before we start the surgery. We get the results. Patients can actually go back. The hospital will coordinate with us that the results are all okay, everything is fine, and then we are then able to then appoint the patient. Once they arrive on the treatment day, once the patient is here, they get admitted to the room first, meaning they get their luggage, anything. We take the patients to the room, they check in a bit, they lie down there. Now, a lot of times patients do ask us, can we go out, can I walk here and there? We always say, even if your surgery is at 1 or 2 p.m., but if it's 9 a.m. in the morning, we want you to rest, because your body will be undergoing quite a lot of stress during the surgery, so full rest is required. Once you are admitted, meaning you have a tag, technically you're not allowed to walk out of the hospital, so you have to be here. That's why having a family member is always good. You have someone to talk to, not focus on what you're going to be doing, but just sort of relax and enjoy the day. There's a TV in the room. You can read a book, anything you want to do. Just no eating and drinking for 8 hours before the surgery. So once everything is done, when it's time for the surgery, our doctor will usually speak to the patient first. We'll just explain to you what's going on, so they know that this is the surgeon. Patient relaxes a bit. So I'll just show you what it looks like. Once the patient arrives, they wait in the pre-operating room. So this is where the patients will lie down pretty much there. All their vital signs, everything will be documented and charted in the meantime to make sure that everything is stable. In this time, the operating room will already be prepared with all the equipment that we need to use.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.